Dr. Anubhav Jain is one of the leading joint replacement surgeons in India. Having trained at the best centers in India and abroad, Dr. Anubhav is considered an authority on robotic joint replacement surgeries. He has played a significant role in establishing the trust of the patients in Vardhman Hospital. He and his team of orthopedic and joint replacement surgeons are destined to take Vardhman Hospital to greater heights in the years to come. The medical leadership of Vardhman Hospital is now in his sound professional hands.
A lot of patients in our day-to-day OPD who come with the problems of knee pain. So any patient who's coming over a reasonable age like 50 or 60, you don't have a statistic that this is the right cutoff age, but generally older age patients who are walking in and are crippled with pain over a period of last 6 to 8 months, over a year, are better candidates for knee replacement surgery. Patients with acute pain or pain with lesser duration of time, we usually try and put them on some medication, physiotherapy, and which usually respond very well. Yes, there is a very specific subset of patients who are not actually fit for knee replacement surgery. So we go through a screening whenever the patient is selected for surgery, and during that screening, any unfit patients who are medically unfit, cardiologically unfit, we usually try and postpone their surgery for some medications and then reassess them after a period of 4 to 6 weeks. Patients who have a neurological problem, have some other difficulty in the spine, we would like to get them investigated further, solve their other problem if possible, and only then take them up for surgery. There are a variety of knee replacement implants which are available in the market. Many of them are indigenously manufactured in India, and there are many which are available which are from the world across. Definitely the implants which are available from outside India have been tested over time. That is why they have given us better results with time. We usually tend to use the ones which are internationally made because they give better life of implant. They have been tested all across the world and they have been there in the market for a reasonable period of time. The ones which are in India are definitely more economic, better for our subset of patients, but unless we have a good research background for them, we do not usually try and use them. Patients are able to bend their knee pretty well after a knee replacement surgery, but we usually guide them that they should avoid sitting on the floor and sitting cross-legged. The only particular reason for doing that is just we want to enhance the life of the implant. The implants which are currently in the market usually last around 15 years, but with the use of technologies like computer technology and robotics, we have increased the life of the implant, and we expect the implant to at least last for 20 years. We've been doing computer-assisted surgeries over the last 10 years, and we have got wonderful results with navigation surgery, in which the computer guides us along the patient surgery. So the further advantage over the 2D computer technology is now the robotic technology, and which we have taken up very early across India. We have got good early results with the robotic surgery, and the robotic surgery helps us in getting accurate results with every patient. So the deficiency between one patient and the other is finished, and every patient which comes out from the robotic knee replacement operation theatre is a good one. The life of the implant is better with that, and the recovery of the patient is much faster. Earlier, patients used to take at least 6 to 8 weeks to get back to normal, and now with robotic knee replacement surgery, the recovery time has gone below 1 month. Knee replacement surgery is just not about the surgery. The overall feel of the hospital, the overall approach of the doctor and his team towards the patient makes a successful surgery. Other than the knee replacement surgery itself, which we are already doing the best by using the best of technology in robotics and computerized surgery, the post-operative rehabilitation, post-operative pain control of the patient, the overall environment and the happiness which patient achieves while staying in a hospital, it should be made sure that it is to the comfort of the home itself. The physiotherapy and rehabilitation takes a major part of the success of a knee replacement surgery.
Far from the madding crowds and traffic jams lies this beautiful tertiary care hospital located in the foothills of majestic Himalayas. The drive from New Delhi International Airport takes 2 hours amidst lush green surroundings through an 8-lane super highway. The V sign of Vardhman Hospital signifies the victory of good health over disease. Vardhman Hospital stands firmly on the 35 years of patient trust built by the doctor duo of Dr. Mukesh Jain and Dr. Nutan Jain. Vardhman Hospital is a 100-bedded tertiary care super specialty hospital in the fields of gynecology, laparoscopic gynae surgeries, reproductive medicine, fertility management, in vitro fertilization, orthopedics, joint replacement, arthroscopic surgeries and complex orthopedic trauma. The hospital is housed in a 6.5-acre plot nestled amongst green salubrious surroundings. The 7-story building offers 2.5 lakh square feet of space to house 14 operation theatres, 60 single deluxe rooms and 40 beds for pre-surgery, post-surgery and intensive care. Vardhman Hospital has the latest and most advanced diagnostic facilities in the form of MRI, CT scan, fully automated pathology lab, color Doppler, ultrasound, digital X-ray and bone densitometry DEXA scan. Massive investment in acquiring the best-in-class technology has made Vardhman Hospital establish a new benchmark in terms of world-class healthcare delivery system.